So tell us a little bit about your story behind breast implant illness and how you ended up coming to find me and see me, and what your expectations are for surgery, and what you're hoping to accomplish with getting your implants out.
I actually received my implants 12 years ago, 2008, and for personal reasons, of course, I just felt like it would give me a better body image, which for the first 5 years, definitely, I felt like it was fun to fill out swimsuits and other clothing. But then I just noticed different symptoms that I did not at first realize they were connected to breast implants. I just felt like I was getting older, I was stressed out. But I started noticing them even more probably 3 years ago. And it started, I was extremely lethargic. No matter if I slept 6 hours or if I slept 15 hours, I was still super tired. Other than that, I noticed after the implants that I was very prone to rashes. Anytime the doctor prescribed me medication, I was that person who received all the symptoms that were skin related. I actually ended up in the hospital for that reason. Brain fog, insert that one for sure. Very high anxiety. I've always been a little bit anxious, but since I've received the implants, it gets worse by the day, where I'm having 1 to 3 panic attacks a day, and they last 15 to 20 minutes, and I feel like all 4 walls are just caving in. So when I went to a different surgeon to check in on it, they suggested that it's just time to replace them because they are 12 years old. And something in my gut just said that's not for me. So about 2 years ago, one of my best friends, she actually stumbled upon you, and she said she had a meeting with you, and I went with her to her consultation for breast implants.
Okay.
She had hers removed 2 years ago, and she's just kept me in the loop.
Yeah.
And I knew that this was something that I also wanted to do. I just was waiting for personal reasons for timing, and there's no better time than now, tomorrow.
So did you end up seeing other physicians related to the symptoms that you were having prior to stumbling into breast implant illness?
And I actually had blood work done because I felt like just something was off, but all of my blood work, aside from hormones being imbalanced and developing hypothyroidism, everything else looks normal.
So you had all the typical diagnostic tests, and most of the physicians that you had seen up to that point basically just said, we don't find anything wrong with you.
Matter of fact, they
Based on
say
your
you're in
results.
amazing shape and great health, and we don't see anything
And
wrong.
you just knew though that you just didn't feel right, you didn't feel like yourself, you were having progressively worsening symptoms, and nobody could really kind of put their finger on what it was or give you like an actual diagnosis that would potentially allow you to start getting treatment and help you feel better.
And when my friend had hers removed, she actually introduced me to a Facebook page where so many other thousands of women are on it, and they share their stories and their symptoms.
Which page is that?
I believe it's Breast Implant Illness with Nicole.
Nicole, okay.
Mhm.
Yep, that's the really popular one.
Literally, when I was scrolling through that, I spent 3 days straight. Like, you know how people binge on Netflix? I was binging on this Facebook page, and I
Because
just
it's
thought,
the validation that finally you're like, there's other people out there like me, right?
100%.
Yeah.
Yeah.
So
And it helped me sympathize for those who have it worse than I do, and makes me thankful that we are not alone, and it's not all in the head.
I think that's the most frustrating thing, besides not feeling well for patients with breast implant illness, is nobody will validate their symptoms. Sometimes not their family, not the physicians that they go to, not even the plastic surgeons that put the implants in or that they're looking to potentially make recommendations to get them out. So It can be very frustrating for patients because they feel like, I know I just don't feel right, I don't know what's going on, and I'm not really getting any clear answers, and I'm not getting anybody to really validate that I have a legitimate, medical condition. And, despite going to multiple doctors, they're continually told that it's either in their head, psychiatric, getting older, or, best case scenario, you've got some kind of chronic inflammatory condition, and, you're going to be on, medications for the rest of your life, and sorry, there's no great, solution to solve your problem. You've got, some kind of fibromyalgia or chronic fatigue or, some condition that just isn't really amenable to. Fortunately for you, you were in a minority of patients that was able to learn about breast implant illness, and now you're here and in preparation for surgery tomorrow. So you came to me directly through a referral
Mhm.
that of a patient of mine. There's lots of patients out there that aren't so fortunate that are going through life and not feeling well and may not even know that there is something related to the breast implants that are causing the symptoms that they're having. And
It's very true.
so we're trying to get the word out, so to speak, and educate prospective patients about getting their implants out, and at least make them aware of what the options are, and make that something that they realize is a potential issue with the way that they're feeling, so that they can learn about their options and decide if that's something that they want to try to pursue.
Yeah.
Surgery is actually tomorrow now.
Yeah.
So tomorrow we're doing the M block, the explant, and with the lift.
We're doing the one and done.
Well, I think that's good, and that's important for a lot of patients.
Yeah.
It's interesting because I have a history doing a lot of breast cancer reconstruction,
Mhm.
and there's actually a similar analogy between women that are getting breast cancer reconstruction and getting their implants out, because the mindset of the breast cancer reconstruction patient is that ideally they want to have one surgery, and that's going to both solve the functional issue, which is the breast cancer, and make the breast look as good as possible. So it's very common in plastic surgery to do what's called immediate reconstruction,
Mhm.
meaning we're taking care of the medically necessary issue, the cancer, and we're going to make the breast look as good as we can at the same time, and put in an implant or a tissue expander, or do a tissue reconstruction to restore the shape of the breast. So this is the same with breast implant illness. I mean, really the kind of foundational procedure is getting the implants out and helping you feel better, but then since we're in surgery, we want to do something at the same time that obviously maximize the appearance of the breast. So in a lot of women, either because the implants are coming out or even because of the way the breasts look prior to surgery, we incorporate like a lifting procedure, a mastopexy, like you're having, to maximize the shape of the breast. And in some patients, we also do some other ancillary procedures to restore volume, and we elected against that for a number of reasons in your case. But we will do the lift, and we'll get some documentation tomorrow of the surgery and your journey. Any specific thoughts or questions or anything going into surgery?
No, I mean, I've done a lot of research on my own, so I pretty much know what I'm getting myself into. Then I'm jumping with both feet because, like I said before, it's time.
Our experience is the vast majority of patients notice, I'd say, almost immediate improvement in the way that they feel.
Yeah. I think
So-
that's the most exciting part for me too, not just to feel it, but to physically be able to see it side by side. I've not one person that I've known has looked the same when they come out. It's almost as if they're giving a little extra life when you come back out.
The quickest things we see with regards to improvement in your appearance after surgery, besides symptoms, is just the brightness in your eyes and in your skin. So
It feels like yesterday. I remember when I got them, and I seriously thought it felt like an elephant was sitting on my chest, and it took a good 2 weeks for me to even get used to the weight. So I know recovery is what it is, and I need to take it easy, but I have a strong feeling that because I'm not going to have that extra weight, it's going to make it easier to recover.
you're gonna do great.
I'm excited.
Good.
Thank you so much.
Yeah, my pleasure. We're looking forward to getting y'all taken care of and documenting your journey. Appreciate you letting us do that, but also more importantly, I'm sure the people that are going to be watching this and learning about breast implant illness and what you're going through hopefully will help them learn about what it is and how they can potentially find help for whatever their particular situation is.
I agree. I think it's good to either prevent or help those who need help on removing.
Good.
100%.
Awesome.
Yeah.
I'll see
Thank you again. I'll see you in the morning.
Yeah, right
Hope I
early.
sleep.
You will.